Hello, I'm Naomi Eisenstadt, and I am the designated independent chair of Northamptonshire's integrated care system. Well, the reason that I'm so excited about the role and why I was excited about NHCP is that at the front of all the guidance are the four key aims, which is about improving health for all, reducing health inequalities, value for money, and also the NHS contribution to the wider economic and social benefit of the communities it serves. And I think it's important. I don't want to, state the obvious, but the reason that you need to improve health for all, as well as reducing health inequalities, is that you could reduce health inequalities by decreasing some of the progress that we've made. Health inequalities are about the difference between the best performing and the worst performing. So if you bring the best down a bit, you reduce inequalities. We don't want to do that. We want to lift the bottom while making sure that the top stays as good as it is. Well, the important thing to talk about is the legislation that's going through Parliament right now. And basically, they are eliminating clinical commissioning groups and handing over the responsibilities of clinical commissioning groups to integrated care boards. In addition to that, integrated care boards will have a role across the system in terms of the acute system, community services, primary care services, and some local authority services. And the purpose is to make sure that the whole is greater than the sum of the parts. Some of the reasons that the new legislation has been drafted is because it was felt that in terms of each of these core bits of both the NHS and local government, they were not working particularly well together. And some of the competitive tendering processes meant that they were in competition with each other. And the public was not getting the best service out of each because of the failure to work together. There will be a wider group, which is the integrated partnership. The wider board will be responsible for doing the strategy and planning. And the integrated care board, the narrower board, will have to take heed to what's recommended by the wider partnership, but will be held accountable for, this is the most important part, for the budgets and the delivery of statutory health services, as well as some statutory local authority services. So it's a statutory role, which is quite different from how we currently operate.